Thank you, Mr. Speaker. It's kind of hard to come after the gentleman from the 5th who said more than what most of us possibly could today, and from deep within the heart. I think we need to really understand what this bill is actually about. Doctors base their decisions on the best method of treatment based on each individual patient. It is not the place of the legislature to interfere with the doctor-patient relationship. This law would deny access for women to a standard of care that is safe. As the gentleman, the chair of health acknowledged in judiciary, this is a reasonably safe procedure. Those were his exact words. It is reasonably safe. It denies the ability to fall within what is the standard of care as developed by doctors, even when it is the best option for women. This law is focused on pushing political agendas instead of ensuring that doctors are able to provide the best individual care and expertise for women. This bill is designed to deny access to a safe and common procedure in order to make it harder for women to seek abortion care. This procedure is used in about 95% of the cases today that this bill seeks to address. There is no reasonable alternative to this that is available today. It just doesn't exist. When we questioned the alternatives to this in judiciary, we learned that one of the procedures that's being recommended isn't even being taught to med students. It is not something that OBGYNs have in their repertoire today. So what happens when you don't have a reasonable alternative to this? That means you're going to deny access to a woman's most personal decision, which she should be making with her doctor and her family, not her legislature. Every pregnant woman faces unique circumstances, challenges, potential complications. Reproductive health care providers must be able to provide their patients with the best and highest quality medical care based on their medical judgment and their patients' needs, not political agendas. This is not about medicine. This is about trying to stop a decision. This is trying to prevent access to medical care. Let's be frank, the goal of this bill and the many restrictions that have been proposed in this legislature is to eliminate access to abortion by making it too hard, too difficult for people to afford. You know, many women are going to have to travel, particularly from here in the center part of the state. They're going to have to travel out of state in order to receive the kind of quality care that they seek. It's going to be difficult, and it's going to be illegal. We shouldn't be criminalizing medicine. This is the second bill in a few days where we're creating crimes for doctors. Let's create an atmosphere of safety where the legal and personal decisions of women in consultation with their doctors and their families are protected. I urge a no vote.